Hi, my name is Sydney McCloskey, and I will be doing my presentation on SARS, which it stands for Severe Acute Respiratory Syndrome. So here's a small introduction to SARS. It is a severe and atypical form of pneumonia. It was first noticed worldwide in 2003 when there was an outbreak in Southeast Asia. It spread to more than 24 other countries, including countries in North America, South America, Europe, and Australia, and also Africa. And overall, the outbreak produced about 8,000 cases and 750 to 800 deaths. That number fluctuated depending on the website. And then, so there's a backstory to this outbreak in Asia, and it started from a physician who lived in a province of China called Guangdong, and he treated a patient that had SARS, and he contracted it and didn't know. And he was supposed to attend a wedding in Hong Kong. So he showed symptoms of having SARS, but he felt well enough to go to the wedding. So he flew to Hong Kong, and there for the wedding, he stayed at a hotel. And the hotel was a place where a lot of international travels also stayed. And so just him being there, he also infected other people. And so when those people traveled back to their home country, they had the disease, and then the disease was where their home country was, and so it spread that way. And that's just an example of how world travel can spread disease to the world. And here is just a geographic outlook of where this all stemmed from Hong Kong and just went all over. So where did the SARS virus originate? SARS comes from the virus coronavirus, which is the same virus that causes the common cold. Um, the coronavirus, there are very many types, and so SARS is just like one of the types that there are. There is human SARS coronavirus, there is bat SARS coronavirus, and civet SARS coronavirus. However, bats were found to be the carriers slash natural reservoirs of the SARS coronavirus. They were able to trace it back using like phylogeny and clades and the whole genome thing. Um, however, bats, for the most part, bats weren't giving it directly to humans. There was usually an intermediate host, and they were civets. So the civets, so the bats would give it to the civets, and then in China, they have civet farms where um, they like grow these civets so they can sell them to markets, and so the markets can sell them to people to like eat and stuff. And so then the civets gave it to humans that way. And over here I have a picture of a horseshoe bat, and kind of freaky looking. But horseshoe bats were shown to be carriers of the SARS coronavirus. Um, they did a study of the groups of bats, and horseshoe bats were ones that carried it. So some characteristics of the SARS coronavirus are that they are enveloped, they are positive single-stranded RNA, they're approximately 78 nanometers in diameter, and they have glycoproteins present on the outside of the cell or of the virus, and you can see that in the picture, the things stemming from the spherical virus. And so the genus is Beta coronavirinae, and then the species is SARS coronavirus. So transmission. SARS is mainly transmitted through person-to-person contact, close person-to-person contact, and so this includes talking to someone within a distance of 3 feet, and hugging and kissing, basically like any form of touching as well, and obviously sharing food and stuff that is going to be a factor in spreading it. You can also spread it through respiratory droplets, so coughing and sneezing. These droplets go through the air, and when they land on a surface, the virus can actually live in the droplet for up to 6 hours. And then once the droplet dries, the virus can still survive for another 3 hours. So it likes to stick around. And then another thing is the live virus can be found in stool for up to 4 days. Some symptoms of the SARS coronavirus. Um, the infected person will show or will have a fever of 100.4 degrees Fahrenheit or 38 degrees Celsius. And then usually 2 to 3 days after the fever, they will develop a cough and have difficulty breathing. They will also probably get a headache and muscle ache, and diarrhea is also another symptom, things like that. So what it actually does is essentially it damages the air sacs of the lungs, and this causes the lungs to become inflamed, and then the damaged air sacs have a really hard time getting oxygen through to the bloodstream, and so you can see why this would make breathing more difficult and painful. Um, so yeah, and then in this picture here, since SARS is like so similar to pneumonia, and generally the infected patient will also have pneumonia. Um, so here's just a picture of what that looks like to the lungs. You can see some inflammation there. And treatment. So treatment for SARS is mainly just treatment for pneumonia. There's not a lot they can do specifically for SARS. Everything I was reading was just saying treatment can sometimes be effective, it sometimes can't. But some of the things you can try are antibiotics, steroids to reduce swelling in the lungs, and then mechanical ventilation, which is like breathing, breath support. I put a picture of an endotracheal tube because that helps breathing. That's assisted breathing. And then you can also try antiviral medication. So thank you so much for listening to my presentation, and I'll see you guys in class.